Hello, it's Robert here, and then just a short version to help a fact checker and science blogger in helping people who are scared of various things. And this is for those of you in the United States, and just a little glimmer of hope already that you can see the curve is beginning to just start to level off the cases per day. Very high, 187,000, but just 171. That's to the average 170,000. It's just beginning to curve off, though. See, it would be going up steeper and steeper if it was continuing to double every 3 weeks. It's beginning to level off. Now, it's another good. The deaths are lagging, so they're going to go up, and then they'll start going down much later, a week later. As you can see, it's about a week later, a couple of weeks later or something. But so then, if you look at this chart gives a more detailed look at it state by state. This is the R0 number, and when this is above 1, which is the red ones, then that means that it's increasing. When it's below 1, it's decreasing. And I'm glad to see that North Dakota has just gone into the decreasing category. So we've got 6 in the decreasing category, and the rest are in the increasing. And these ones right at the end here, they're increasing quite a bit, but none of them are increasing anything like they would be if it was totally suppressed. So if you have a look at like for instance Alabama, and look how it came right. So right at the beginning, that was close to 2 or something. When there's no precautions being taken, it's 2.5. See how it goes right down. Then it was decreasing a bit, then increasing and decreasing, increasing. It's still increasing, but it's only slightly above. So it's a big drop, the initial drop they've all had. You can see all the way down. Just nearly all the states have had huge, started off very high fast rates, and then they decrease. Now, a state that was prepared for this, and that had put all the tools in place already before it arrived, wouldn't have that at the beginning even. It would start off low, and it would just go down. But anyway, so they weren't prepared at the beginning, but they've gradually put enough precautions in place, just keep it above or below 1. So the reason it's gone up, the reason it's got so high, is because for several weeks, a month or two, several months in fact, they've been above 1 in most of the states. See, a lot of them have been above 1. For instance, that's been above 1 since. I need to get my glasses. Connecticut has been above 1 since August, and many of them it's been sort of towards the end of the summer. They've been above 1, and they've stayed above 1 since then. And that obviously the not wearing masks and lack of physical distancing that we've all seen on television is obviously a big factor there as to why they went above 1. It doesn't take much. So a few people not wearing masks, a few people not physically distancing is enough to move it from just below 1 to just above 1. Once it's above 1, it starts going up and up. The flip side of that is that a few more people wearing masks, especially if everyone wears masks, and if everyone does the physical distancing, everyone washes their hands properly, and that will bring it down. And if you've got testing and tracing and isolating, supported isolation and supported quarantine, then in New Zealand, as I showed before, in New Zealand, then it got down to well below a half to a quarter, and you could be to 40, something like 0.4 or 40% transmission. So there's no reason at all why the United States can't do what New Zealand did if it did this really effectively and thoroughly. So you can all do your bit. So you could all be a superhero in the United States and help it to stop this transmission. As Mike Ryan put it, that if you are, the virus, it doesn't have a mind, but it's evolved to, your body attacks it, and then the virus has to get out of your body and infect someone else. So if you are, if someone else has been infected and then you do the physical distancing and you do the hand hygiene and face coverings and everything, and if you do that sufficiently systematically and rigorously, then you're very well protected. It's like crossing the road and looking both ways. And my crying has been all the on not drinking and driving, things like that, and it's even more effective because than that. And that's my crying is an example I gave, and Maria Van Kerkveen, my crying doing, they're the head people in he goes in every day on public transport in Geneva, and he hasn't got COVID-19. So if you do that, then you are the end of the virus. It either doesn't get to you, but the virus just won't get to you if you do that really carefully, and if all your mates do that as well, or you keep physical distance from anyone who isn't doing that, then you're very well protected, and that's where you can be the end of the virus. So the virus wants to escape from this body, and you're there, and it doesn't get to you. If you don't do that, then the virus gets to you. And the same if you've got COVID-19, if you isolate from other people, you're being a superhero as well. Because once it's got to you, it then needs to go to someone else. And if you quarantine, if you contact, if you isolate, if you've got it, then, including from your own household, then you are the end of the virus then as well, because it's not going to anyone else. And if everyone does that, the virus can no longer spread, which is the only way it can spread. So we all need to be Spider-Man superheroes, and even if we're not perfect, we can help reduce it below 1. And then it'll just go down and down and down. And then with the vaccine, then that'll push it even further. That'll also help get it below 1. So that is why the situation is looking very, very promising. And I think just the matter of everyone wearing masks, the CDC think it's more important than the WHO do. Whichever is right. Then the WHO one was some weeks ago. I'm not sure if they changed their views on the matter. But either way, mask wearing alone for some of these, like this one, like Alabama, mask wearing alone is only slightly above. You can move it slightly below doing the mask wearing properly. And doing the physical distancing properly makes a huge difference. And the isolation and the quarantine. If you don't need to wait for someone to say you're a contact. If you know someone who's got COVID-19, and then and you know you're a contact of them, or if you've got COVID-19, tell all your friends and say, I've got COVID-19 and I was a contact with you. So if you want to protect your friends, your loved ones, then quarantine. You may want to quarantine or isolate and talk it through with them. So you don't even need to wait for the contact tracers. Again, the WHO strongly recommend. My client said that if he was ill, that's what he would do. That he would tell all his friends. He said that the contact tracers are so overwhelmed around the world, and you can do your bit by being a contact tracer yourself, just for the people that you're contacts with yourself. And tell your contacts. And if you're a contact, then check the person you got it from. And the thing is, if you were a contact with them 2 days or less before they develop symptoms, then they may have infected you. If you were close within 1 meter of them, or in other ways, these other things that make you a contact. So do that as well, and just do it all. So do it all. The face coverings, contact tracing. You can do your own contact tracing. Don't think that's just something that the government has to do. If you are a case or you're a contact of a case, then you can decide off your own back that you want to quarantine. You can ring them up and say, I am a contact and you didn't know, you haven't noticed yet, and ask for their advice. And then the physical distancing, the vaccination and the mass testing, obviously you can't do yourself, but when there's mass testing then you can get tested. And there's hand hygiene you can do yourself, the quarantine you can do yourself, the stay informed you can do yourself. I strongly recommend the World Health Organization, the materials on their website, and the weekly social media WHO/A, which is usually on a Wednesday. And then when the vaccination comes, then the vaccines will be very safe. Educate yourself about the vaccine. If you have concerns about the vaccine, then stay informed, educate yourself, listen to what the experts say. Don't listen to the infodemic and the fake news. Try and find good, reliable sources on the vaccination and what the real risks are. And it's really the safest vaccines ever because of when first approved, because they're going to have massive safety data to evaluate, and they'll only pass them if they're very safe. Anyway, check that for yourself, and then make a decision based on informed information, on good information, rather than on rumours and hearsay and infodemic and poor sources. So you can do all this as stuff you can actually do yourself, and make your own decisions about the mass testing. And it's a strong recommend you get tested, but especially if you've got the symptoms, then to get the PCR test. And then so some people don't want to get tested because they're afraid that if they get tested they'll have to stop their work and they have to isolate. But if you get tested, you'll get the appropriate care. If you get tested later on, you develop long COVID, which is 1 person in 20 gets long COVID, and it goes on and on and on. And if you got tested, then because you can only be tested properly early on when you get the symptoms. Once you're 2 weeks into it or something, you may very well not show up as having COVID anymore. But if you got long COVID, then you may end up being run down and not able, breathless, going to your shop, and you used to run up and down mountains on mountain bikes, and you're forgetting things after a few minutes, and short-term memory issues. These are two of the most common effects of long COVID, and they'll look at you and they won't find any virus left. They might find, they find that doing the serology, they could show that you have been infected, but they won't know that this is the result of it for sure. So that's another reason to get tested early on. But get tested early on so you know you have to isolate. You know that you have to, that your contacts can quarantine, because if you are at the end of the virus, then it just stops and it doesn't go any further. Even if you got it, then you can stop it going any further. You can stop it getting to you by doing all these measures. You can stop it going any further if you do get it by isolating, quarantining, or if you contact, quarantining. If you don't do that, then you're going to infect someone else, who infect someone else, who infect someone else. And at the moment in the United States it's doubling every 3 weeks. But if it's uncontrolled, if one of those is a super spreader, you could easily infect 100 people. If you 2 or 3 weeks down the road, if along the lines one of those is a super spreader, or it goes to a patch of uncontrolled transmission. A group of people are not taking care. So so everyone, be careful, do it all, and then we can get back. And I showed that on the previous one, and let's just bring it up again, the 20% thing. Yeah, there we go. Do it all, and we could get back here maybe a month or two earlier than if you don't do it. If you do really effectively, it comes down really, really fast, like they showed in New Zealand. But even the more that do this, the more it's going to be like this, and soon it'll be like this. So things are looking much better in the US than it seemed at first. And I personally think that Biden is going to be like Jacinta Ardern in New Zealand. Nothing to do with his internal politics, but just because he's got the right policies on COVID-19. He's doing things right, so he's going to help you turn things around.